Hello, my name is Dr. Tracy Wang, and I'd like to welcome you to our ongoing series in the Department of Surgery on programmatic developments here at the Medical College of Wisconsin. Today I'm being joined by Dr. Rana Higgins. Dr. Higgins is a minimally invasive and bariatric surgeon here in the Department of Surgery. She did her undergraduate degree at Duke University and her medical degree at Loyola University. She then completed her general surgery training at Rush University in Chicago before joining the Medical College of Wisconsin for her fellowship in minimally invasive and bariatric surgery. We've been honored to be able to recruit her here to join our faculty.
Thank you.
And today we're going to be discussing obesity and the role of bariatric surgery. Welcome, Dr. Higgins.
Thank you, Dr. Wang.
If you can start telling me a little bit about how obesity affects a patient's health and why it's important to manage weight.
So obesity has a lot of systemic effects on someone's body. It can affect blood pressure, it can cause high blood pressure, diabetes, heart disease, cholesterol, sleep apnea is a big one. So there's an innumerable amount of medical issues that can be caused secondary to obesity. So the whole purpose of bariatric surgery is to really address those medical conditions. A lot of people focus on bariatric surgery as a weight loss operation, but as bariatric surgeons, we really consider it as a opportunity to really resolve a lot of those medical conditions.
And what do you consider someone's weight to be in order to be obese and to qualify for bariatric surgery?
So to qualify for bariatric surgery, typically people are at least 100 pounds overweight, and they've struggled with weight gain for a significant amount of time. For at least 5 years is typically what's required by insurance. And people will usually have one of these medical conditions that I just discussed, so sleep apnea, high blood pressure, diabetes, to a point where it's really affecting their quality of life.
And what are the benefits of bariatric surgery as opposed to a rigorous diet and exercise regimen for patients who have, who are as overweight as you mentioned and have other symptoms?
So it's a question we get asked all the time because obviously medical weight loss is, the United States spends about $50 billion on that every year. So what we know is that over the long term in someone's life, if they do diet, exercise, any of the medical weight loss options, there's a 100% long-term failure rate. People will gain weight, they'll often gain more weight in return, whether that's over 1 year, 5 years, 10 years. So the thing with bariatric surgery that's really important is the long-term effects, that there's long-term weight loss, and that is sustained much longer than in people who try just diet and exercise.
So how does someone qualify to be considered for bariatric surgery?
So to be considered for bariatric surgery, you have to qualify based on your body mass index. It's a number that you can find online, and basically you plug in your weight in kilograms over your height in meters squared. And anyone considered a BMI or a body mass index over 35 is considered severely obese. Now, different insurance companies have different requirements, but typically if your body mass index is between 35 and 40 and you have an obesity-related medical condition, like I mentioned before, sleep apnea, high blood pressure, diabetes is a big one, then you would qualify for bariatric surgery. If your body mass index is 40 or greater, typically, most insurance companies don't require any medical conditions, which I think is really important from my standpoint in trying to prevent these medical conditions from occurring. Not just doing the surgery once people have the medical conditions, but if they are obese with that body mass index over 40 and they're young and they don't have medical conditions, we can intervene early in their life and really impact them in the long term.
And for someone who has BMI and some of the other conditions that you do mention, what is the long-term effect on those conditions like diabetes or sleep apnea after successful weight loss and surgery?
So the biggest medical condition that's been studied in regard to bariatric surgery is actually diabetes, specifically diabetes associated with the gastric bypass. And long-term success rates of diabetes, so at 6 years, the literature has shown that 60 to 70% of people will have complete resolution of their diabetes. So no medications, no insulin. About 30% will be off insulin and on oral medications. So it's a very small percentage, usually between 1 to 10% of people who have no change at all in their diabetes. Those are typically people who've had severe diabetes from a young age. Now, diabetes has the strongest impact, but sleep apnea, about 80 to 90% will be cured of their sleep apnea after 6 to 9 months. High blood pressure, about 50 to 60% of people have improvement. A lot of that just depends on the cause of someone's blood pressure. Heart disease, polycystic ovarian syndrome, 80 to 90%. There's a variety of medical conditions, the majority of which are significantly improved, if not completely resolved, after bariatric surgery.
Now, you mentioned gastric bypass as one of the options for bariatric surgery. Can you tell people who might be watching this what are the different options for surgery? Because there are different types of procedures that can be performed.
So here at the Frederick and the Medical College of Wisconsin, the two procedures that we perform are the laparoscopic sleeve gastrectomy and the laparoscopic gastric bypass. All done with 5 to 6 small incisions. Surgery takes between 1 to 3 hours, just depending on the complexity of the case. And you know, the what type of surgery to choose is a very personal decision. So we have an orientation process where we introduce people to the two different options, which people would be a better candidate for one or the other. Weight loss outcomes with the gastric bypass are a little bit more. So people typically lose about 70% of their excess weight with the gastric bypass. So if someone's 100 pounds overweight, they'd lose 70 pounds. With the sleeve gastrectomy, people lose about 60% of their excess weight, so they'd lose 60 pounds if they were 100 pounds overweight. So both have great weight loss, a little bit more with the bypass. The bypass is a little bit more of a complex operation, so some people aren't the best candidates for it. So that's a decision that we make with each patient individually based on their medical history.
And can you tell me why someone should consider seeing someone here at Frederick and the Medical College of Wisconsin and a minimally invasive trained bariatric surgeon for their surgery and discussion about weight loss?
So I think the important thing to focus on is the successful outcome after surgery. So we think of it as a comprehensive center, multidisciplinary center, and we have our complete comprehensive weight loss center. So it's not just us as surgeons. Surgery is really just a tiny piece of the entire thing. We think of surgery as the tool to help, but ultimately it's all the resources we give that are critical to everyone's success. So we have dietitians, health psychologists, we have a whole endocrinology team who works on medical weight loss before and after surgery. So I think here at Frederick and the Medical College of Wisconsin, the biggest advantage is that we really have a comprehensive center where we address all issues related to bariatric surgery. It's not just the surgery, it's the person, the previous trauma, food addiction. You know, there's so many different aspects of obesity that I think if you just go somewhere where it's not as comprehensive, you risk not being as successful.
And what is the typical timeline? You mentioned a lot of the support services that are provided here that patients need to go through in the evaluation prior to surgery. What is the typical timeline for that process?
So typically the way our timeline works is once we get the referral for bariatric surgery, you can do an online orientation or in-person orientation. Then you'll meet with the surgeon after you complete the orientation. Once you meet the surgeon, the process from there, timeline-wise, just depends on the insurance company. Some insurance companies, it takes 3 to 6 months. Some, it just takes a couple of months. Part of that just depends on requirements by the insurance company. So in that whole process, you'll meet with our dietitian, our health psychologist. You'll have at least one visit with our endocrinologist, if not more, whatever's required by the insurance company. I would say on average here, most people from time of seeing the surgeon to surgery is about 6 to 9 months.
And can you talk a little bit right after surgery? What is the process for recovery, getting back to work, getting back to normal activities, and what patients can expect?
So our patients typically stay in the hospital overnight, going home the day after surgery. Our nurses here at Frederick and the Medical College of Wisconsin are great with getting our patients up, moving right away, even the night of surgery. So we want you walking and moving. Like I said, you go home the next day on average. After that, usually we tell people to take about 4 to 6 weeks off of work. Not because we want you to not be moving around, but just because we want you to have that time to adjust to the diet and, drinking enough water and the new lifestyle that you have. So mild to moderate activity for the first 2 weeks, then you can increase your exercise after that. But we typically give about 4 to 6 weeks off of work to give you time to adjust.
And what would a post-bariatric surgery diet entail?
So we have 3 stages of our bariatric diet. The first stage is the stage you're on for 2 weeks after surgery. It's a pureed kind of baby food consistency. Then we see you in clinic at 2 weeks, and after that we put you on a stage 2 diet, which is soft food, things that can be mashed with a fork. At 6 weeks you resume a regular diet, the entire time focusing on protein, and we give you all of those resources for great ways to get protein, focusing on water intake. The reason we have you do kind of a softer diet the first 6 weeks is there can be a lot of swelling that occurs after surgery. So we just want to make sure the food slides through, doesn't get stuck, and cause you the least discomfort.
Great, thank you.
Thank you so much.
Are there any other tips or things that you feel it's important for someone who's considering bariatric surgery to know?
I think it's just important to know that really think about your social support system and what your personal goals are. I think as a bariatric surgeon, the thing we like to stress the most is not so much the weight or the number, but how you feel about yourself, how your quality of life is. And, if you're struggling with obesity, there's lots of resources we have for you to help you. And we just want you to be a part of the team.
Great. And what's the best way for patients who are interested to contact the program and perhaps set up an initial orientation?
So we have a comprehensive metabolic weight loss website that you can go to, and that has our 1-877 number on there as well.
Perfect. Thank you so much, Dr. Higgins.
Thank you, Dr. Wang.